Welcome, I'm Dr. Melina Roberts, and I want to talk about this great therapy called ozone therapy. And if you haven't heard about ozone therapy, you're about to learn a lot about this great therapy that has been around for over 125 years, and there is over 6,000 published studies that show that ozone therapy is effective and safe for a number of different health issues. So ozone is made of 3 oxygen atoms stuck together. So the air that we're breathing is made with 2 oxygen atoms stuck together. Medical ozone is formed from medical grade oxygen being electrically activated with an ozone generator to form ozone at a specific concentration. Now, our health depends on having healthy blood. If our blood lacks oxygen, then what happens is that we end up having dysfunction, then we have degeneration, and this can eventually lead to disease. So what ozone will help to do is it'll help to oxygenate the blood. And over time, if you're doing ozone treatments, what it's helping to do is it's actually helping to cleanse the blood completely. Now, ozone often gets associated with pollution. Now, what's important to know is that ozone is a naturally produced substance. And what happens is that ozone is actually naturally produced about 20 to 30 kilometers from the Earth's surface. So when the UV lights from the sun hit the oxygen that's surrounding the Earth, then what happens is that it creates ozone. And ozone, since it is heavier than air, then what happens is it actually drops towards the Earth's surface. And as it's dropping towards the Earth's surface, it actually is grabbing onto the pollutants that are in the air. So it's actually cleaning up the air. So this is how it relates to pollution. So it's not that ozone itself is a pollutant, it's that it is actually cleaning up the pollutants, and ozone is easier to measure than the actual pollutants themselves. Ozone therapy doesn't have any negative effects on healthy cells. This is one of the positive effects of ozone therapy. Now, ozone therapy has a number of different beneficial effects in the body. It helps to oxygenate our cells, it helps to improve circulation, it has antimicrobial effects in the body, and it also has anti-inflammatory effects in the body. Now, ozone therapy in the body is a oxygen-rich therapy, and it's also highly reactive. Now, ozone in the body creates reactive oxygen species called ozonoids. Now, these ozonoids are actually oxidants, so they are electron seeking, and they are actually signaling molecules. So they are signaling between cells. So they are helping with that cell-to-cell communication and helping to activate different cells within the body. And these reactive oxygen species can stay within the system for a longer period of time and have a longer beneficial effect within the body. Ozone helps to oxygenate the cells. Now, ozone helps to increase the 2,3-DGP in the red blood cells. Now, the red blood cells help to bring oxygen to all of the rest of the cells in the body. And The 2,3-DGP helps to release that oxygen to help to increase the oxygen that's getting into the tissues. So it actually helps to increase tissue oxygenation. And when we get an increase in the oxygen into our cells, into our tissues, into our organs, we actually also get an increase in mitochondrial function. And mitochondria is what helps to make energy, that ATP, for all of our cells, which helps with how all of our cells function and our tissues function and how our organs function. Ozone also helps to increase red blood cell flexibility. So red blood cells are able to easily travel around the body, even into small vascular areas in the body. Ozone also helps to improve the negative charge on the cell membranes of red blood cells. So then the cells make sure that they repel each other instead of sticking together. And ozone also helps to increase nitric oxide, which helps in vasodilation. Ozone has also been shown to be antimicrobial. So it's antiviral, antibacterial, antifungal, antiparasitic. So what happens in terms of viruses is that ozone can actually destroy the capsid of the viruses, which can render that virus inactive. And in terms of bacteria, it's been shown to actually kind of poke holes into bacterial cell membranes, which again can break down those bacteria. Ozone will inhibit fungal growth. So ozone sets up an environment that is inhospitable for infections to be able to live. Ozone has also been shown to be anti-inflammatory. It helps to modulate the immune system. When we have pro-inflammatory cytokines in our system, then we get swelling and edema. And with that swelling and edema, it makes it challenging to get proper oxygen to those tissues. Now, what the ozone helps to do is it helps to modulate those pro-inflammatory cytokines. So it helps to bring down the number of those pro-inflammatory cytokines. And in doing so, it helps to decrease the inflammation in the area and then helps to get proper oxygen into those cells. Now, medical ozone can be administered in a number of ways. One of the ways is through intravenous ozone therapy. And this has been shown to work the quickest within our body because it'll go right into that vascular system and it can have an effect on that blood systemically right away. Whereas there's other ways that we can administer medical ozone and they still are effective, but not as rapid an effect as the intravenous ozone therapy. Now, the other ways that you can administer ozone therapy is rectal ozone. And rectal ozone is putting ozone into a bag and then inserting it rectally with a catheter. And one of the benefits of rectal ozone is, first of all, if it's difficult to find a vein. And then the other reason that rectal ozone can be quite effective is that the rectum is actually highly vascular. And there's also the portal veins. So you will get that ozone right into the bloodstream because it's highly vascular, and then you'll also have direct access to the liver through the rectum, so through that portal vein system. So this is why rectal ozone can be an effective therapy. Another way that we can be administering ozone is inserting it through a needle into different joint spaces. And this actually helps to decrease inflammation and improve the healing in those joint spaces. And another way that you can deliver medical ozone is through auricular ozone. So the auricular ozone kind of looks like a stethoscope that you're put on, and then the ozone actually gets administered into the ears. And one of the benefits of ozone is that it can actually move through the membranes of the ears, and it can actually be beneficial in terms of the entire head and neck and in the inner ear as well. So these are different ways that you can administer or you can receive medical ozone. And I think what's also important to note is that you should be receiving medical ozone from a trained professional who has been specifically trained to administer ozone therapy. All right, so thank you so much for listening. I hope that you were able to learn a lot more about ozone therapy and how it can be so beneficial for a range of different health issues within the body. All right, so thank you so much for listening. I encourage you to share this with your friends and family, to press the like button, to make a comment below, and until next time, continue to learn, grow, and build health.